speed learning app for this preparation. It's helped me a lot, and the interview conducted by the speed, it's also helped me a lot during my interview in INI.
Bring in all the wishes and greetings from behalf of all the faculty members of Speed to you, to Dr. Sunil Soran for scoring AML rank of 9 in Super Speciality of MCH Trauma, Surgery and Critical Care in
Thank
NEET
you, sir.
November 2025. Congratulations to you.
Thank you, sir. Thank you.
Great. So can you share your brief background history about yourself?
Okay, sir. Sir, I have completed my MBBS and MS from Mahatma Gandhi Medical College, Jaipur, and I have completed my MS in traumatology and surgery. I am the first candidate in Rajasthan who's doing MS in traumatology surgery.
Fantastic, fantastic.
Yes, sir.
Congratulations. I mean, trauma interest, when you got this interest in trauma?
So when I was in the MBBS days, when I visited the ER for the and the patient with severe injuries having trauma came. Then I thought that they should get specialized and the evidence-based treatment. So I took trauma surgery for the better treatment and the ATLS protocols treatment.
Very good. Excellent. So once you did this trauma surgery, then super specialty of MCS trauma and critical care is
Yes,
the
sir.
option that has been heading forward.
Yes,
How you prepared and what all you did your preparation strategy to reach this topmost rank?
yes, sir. I choose MCS trauma surgery because I have interested in that firstly, and then I selected speed learning app for this preparation, and also using ATLS protocols and my MS notes. So it's helped me a lot, and the interview conducted by the speed, it's also helped me a lot during my interview in INI. So it's
How long is the preparation time was?
Sir, it's as I completed my MS in trauma, so it's not difficult me for to crack this INI
Yes, you are
because I have
the same.
learned almost everything in 3 years, and so I choose speed for the my concepts and for my interview. So
Great.
it's
So can you share how many questions did you attend this exam and what was the paper concentrating on?
uh,
Something on the paper and also how you prepared for the interview? What was asked in the interview?
yes, sir. Question paper in the question paper, theory question paper, there is a 80 questions, and out of 80, around 55 questions from the trauma and critical care, and the 20 rest 25 questions are from the general surgery. So I 69 questions, I attempt 69 questions to ignore negative marking. So, and I for interview I choose speed learning app, and the MCS trauma surgeon by the speed learning app provided to me for the my interview, and the sir is already a MCS degree, so it's they give me a good response for that in interview.
Great, great. Now, uh, what will be your message to the future aspirants of trauma surgery?
Sir, is that trauma surgery is the emerging branch, and the best surgeons are will be produced by the after MCS trauma surgery. So I want to convey a message to my colleagues or my juniors. You should uh, give a thought for a trauma surgery because it's an emerging branch and there is have a lot of potential.
Very good, excellent. Now, time to thank and whom all you want to thank that they helped your
Thank,
career from day one till date to what you are
thank
today.
you. Yes, sir.
Whom all you want to thank. If you want, you can use this platform to thank all of them who inspired you, helped you to achieve what you are today.
Sir, I want to thank my mentor, Dr. Pranay Kavira, sir, Dr. Avnish Katiyar, sir, Dr. Who already did MCH in the field of trauma surgery, speed learning app, and my teachers and mentors in Mahatma Gandhi Medical College, Jaipur.
So,
Yes, sir.
as a trauma surgeon, you'll be always on toes and always quick on the response to save.
Yes, sir.
And we could see your personality as such. I mean, we knew as in the emergency and the trauma.
Yes. Right
That
now I'm in emergency, sir.
I could see that. I could see that the kind of confidence that your personality as your person you're going to give, you're going to be enormous on the patients and the dentists.
Yes, sir.
I'm in the right hands. So you have that kind of an aura. I could see.
Yes, sir.
For that, I wish you all the best and all the success and great service you're going to render for your trauma and critical care service. Best wishes to you.
Thank you so much, sir.